Hello. Hi, everyone. Thank you so much for joining us tonight. My name is Mondschein. I'm the Director of Research at the United States Studies Center, which is just across the street over there. Before we get started, I want to acknowledge the Gadigal people of the Eora Nation and pay my respects to their elders past, present, and emerging. Tonight's event is a real collaboration. It is thanks to months of hard work by some of the people sitting in the front row tonight, coming from the Sydney Infectious Diseases Institute as well as the law school. This topic is really an important one, and I'm sorry that you have to deal with me opening it instead of my boss, Mike Green. He and Larry, our guests of honor, both affiliated with Georgetown, but we've stolen Mike for a few years here in Sydney, and unfortunately, Mike had a family emergency and wasn't able to make it. Our topic tonight is public health, science, and trust in the Trump era. And you might be wondering why someone from the US Studies Center is opening it. What we do is alliance, defense, politics, or more defense, and you're probably wondering, what are you doing on public health? It's a great question, and sometimes one I have myself, because this is a topic that is unique. Because in a lot of those areas that we focus on at the US Studies Center, sort of the common or conventional wisdom is don't pay attention to what the politicians say, focus on what they do. And that's very true, especially when you look at defense agreements or the implementation of complex projects like AUKUS. Like there's all this like hot air, but then you actually want to focus on the budget and focus on what's actually happening on the ground. Public health is different. Public health, you focus on what they say as well as what they do. And that is something unique and something that is really important. And there are few people who know this better than our guests of honor tonight. And I want to just highlight what the stakes are. So if you've ever had to suffer through my face made for radio or voice made for sound film, you've probably seen me talking about Donald Trump on Australian media. My job in many ways is to explain Donald Trump to Australia, and it's a really boring job. I've nothing going on. But no, it's something that I have to talk about a lot, and I'd like to highlight what is actually important to focus on and what's not. And Larry may not know this, but Australians have a unique obsession with US politics. In 2016, the US and Australia both had elections. And Australians consumed more information about the US election than they did their own. And then in 2020, the US had an election, and there was also a global pandemic. And can you guess what was the #1 Googled term in Australia that year? Not COVID. It was US election news. So the ties between the US and Australia go beyond defense, go beyond the cultural affinity. It actually has impact. And if you look at the numbers on public health and trust in public health, it's pretty worrying. So trust in the US, in the medical system, 30 years ago was 51%. More than half of Americans had trust in the public system. It is now half that. And then, that was from Gallup. And then Pew found in recent polling on whether they think that scientists will act in the public's best interest, a 25 percentage point difference between Republicans and Democrats. And anecdotally, we're seeing similar incidents or evidence of this in Australia, thanks to that high consumption of American politics and American discourse. But the challenge, though, is that this is not an American-only phenomenon. This is something that has global ramifications. And so we're so glad that we have Larry Gostin here to help us talk about this. So to give you an idea of who Larry is, I could literally spend all night reading his accomplishments because there are so many. But I'll just quickly say he's the Distinguished University Professor at Georgetown University's at Georgetown University, and he's the founding faculty director of the O'Neill Institute for National and Global Health Law at Georgetown. He's also the director of the World Health Organization Collaboration Center on National and Global Health Law, and he's been at the center of public policy and law in everything from AIDS and SARS to H1N1 to Ebola, MERS, Zika, Mpox, and in the COVID-19 pandemic, he worked with the White House, public health agencies, World Health Organization, the UN, you name it. Any of the public health emergencies, public health issues in the past, Larry has been actively involved in all of them. And he is not someone who just wants to sit on the sidelines and stare at problems. He actually gets his hands involved and really has made a positive impact on our public health and our public health discourse thanks to his expertise. But he's not alone, even though we are joined by him from many thousands of miles away. He's joined by Professor Julie Leask, who is the professor of public health at the Sydney School of Public Health and Sydney Infectious Diseases Institute, where she co-leads the Social and Behavioral Insights in Immunization Research Group. And her research focuses on the social aspects of vaccination programs, policy, and risk communication for health emergencies. And we're also joined by Professor Andrew Wilson, who's the co-director of the Leeder Centre for Health Policy, Economics, and Data in the School of Public Health at USAID, and as well as a public health physician. So what we're going to do tonight is first we're going to have some keynote remarks from Larry, and then after that we're going to have a panel discussion with Larry, Julie, and Andrew, and then you will be done and not have to suffer through me anymore. So please, Larry, thank you.
Thank you very much. It's really lovely to be back here in Sydney. I've had so many wonderful years. I've been on this podium before. My best friend in the world lives here, Roger Magnuson, professor here at the law school. I just wanted to really give my heartfelt thanks to you all. And I'm here to talk about a very smiley topic, something that will just bring, great joy to all of our hearts, Donald J. Trump. I normally, when I give this talk, I just kind of talk about it as in a global phenomena about what's happening to science, trust, democracy, the rule of law. But for some reason here in Sydney, they said, let's just talk about the Trump era. So here I am, I can do that. So what I'm going to do is I'm going to start with, science and public health under a sustained attack. I'll then look at particularly the Trump administration's actual policies relating to science and health, and I'll be, quite detailed about all of that. I'll give you a little personal reflection on me being fired from the NIH recently, from its scientific advisory committee. I've been told to put that letter up on my wall. Then I'm going to look at health information and its quality quite broadly. I'm the co-chair of a commission for the journal Nature on what's called quality health information for all. I'll talk about that. Then I'll drill down a little bit to look at vaccines and what's happened under Secretary Kennedy. I'll then reflect a little bit on why the public misunderstands science and the scientific method, which I think really is kind of the heart at some of the distrust that emerged, particularly during the COVID pandemic, which really kind of made the reputation of the US CDC, the World Health Organization, and other public health agencies, why they really took a beating during that time. And then I'm going to end with what I think is really behind all of this, in my view, which is where we are now just on basic human values, because I think more than anything, the diminishing of decency, honesty, morality, and the whole notion of the common good, I think is really what hurts the most at the moment. And so that's my method of progression in today's talk. So I think it's fair to say that there's not just a distrust of science, but a lot of misinformation, false and misleading disinformation about health. It's rampant. It's all over social media. It's amplified by artificial intelligence. And if the Trump administration illustrates the idea that kind of even populist governments are now perpetuating false health information, they're actively fueling anti-science beliefs. That's not just from the White House, but also from the Health Secretary, Robert F. Kennedy Jr. himself. What makes this particularly troubling is that if you listen to his language, he attacks science using the language of science, and he talks about the importance of returning scientific integrity and of transparency of data. And for most people, they really don't understand that using the language of science to undermine science is a particularly insidious thing. But what's happened is that when truth is debatable and science is undermined, and democracy and the rule of law have been weakened, but we're also seeing withering attacks on freedom of expression, particularly at academic institutions, and even free and fair elections. And our venerable scientific institutions, certainly globally, like the World Health Organization, but the great scientific institutions of the United States, the US CDC, the National Institutes of Health, the US Food and Drug Administration, they're just crumbling under a strain of populist assault. And so for me, I think in this troubling era, I think I need to, and I hope others will, stand up for science, stand up for public health, and democracy itself. So let me just drill down a little bit about the various ways that the Trump administration has attacked science and health. I've chosen about 6 or 7 areas which I think are particularly salient now, but I could have said many more. Very early in the second Trump administration, with Doge and Elon Musk, the very first thing I think that the administration did was to pretty much eliminate the U.S. Agency for International Development, USAID, which had a history since John F. Kennedy of fierce independence, of humanitarian and public health presence throughout the world. And within a week or two of the administration being elected and coming into office, and the president being inaugurated for the second time, the USAID sign was being taken off the building. There were mass firings, and right now, USAID effectively doesn't exist as an independent agency. It's housed within the State Department, and it's it's strange from a legal point of view because this was an agency that was created by Congress, and it was created to be an independent agency and is now entirely disappeared. Not quite the same thing happened with the US CDC, but there was a mass exodus of scientific leadership, particularly relating to vaccines, but basically from the director who was fired, the deputy director who left, and all of the kind of key leadership were hollowed out all within a week. I've worked with the CDC, for many, many decades. I was actually there with Tony Fauci when the first case of AIDS, an unidentified pneumocystic pneumonia, was identified. And in all those years, working closely with CDC, I've never seen it as dispirited. Scientists just completely demoralized. Many or most of the best ones have left or have been fired. In particular, the CDC's global health capacities have been completely hollowed out. They hardly exist at all. The Global Health Center at CDC has been eliminated, and its presence on the ground in so many places have gone. And most recently, the White House has announced that CDC and its global health reach will no longer be an on-the-ground support, will no longer be a partner, but will actually, people will have to pay for the CDC service. So it's asking low and middle income countries transactionally to pay for CDC to be there. The implications are, clear and consequential. If you look at the two most recent public health emergencies, the hantavirus on the cruise ship MV Hondius, and the novel Ebola strain in the Democratic Republic of Congo and Uganda, can very much be traced to these decimations of USAID and CDC. I just recently came back from Geneva, where I worked with Dr. Tedros for about 10 days, particularly on the Ebola response. And I've talked to people on the ground, health ministries. I've talked to all of the kind of operational heads at the Africa CDC. And as you may know, this was a virus that was circulating for months without being detected. And the main reason for that, there are many, but one of the main reasons for that is that the testing on the ground was for the Zaire species of Ebola. And so all of the samples of Ebola-like laboratory specimens came back as false negatives. And so I asked people on the ground, I said, well, normally, wouldn't you have just sent it to CDC labs? They can send it within 24 hours to Atlanta, and they certainly would have picked it up and reported it back within 48 hours in a correct way. Why didn't you even send it? And the DRC Health Ministry, the Africa CDC said, it never even occurred to us because USAID wasn't on the ground, CDC wasn't on the ground, and there was just no ability to test, surveil, and bring the outbreak under control. The other thing that's been happening at the CDC in particular, but also more generally, is that the Trump administration has been censoring CDC's website, and it even has to have pre-approval of CDC scientists that are publishing in the journal MMWR, which, as you know, is kind of the flagship public health journal in the United States, particularly for outbreaks and other novel health threats to the United States and globally. And so one of the things that I've always done my whole life when I really wanted to figure something out to do with public health, I would always look at the CDC's website. And unfortunately, that's not a safe harbor anymore because it's politically controlled. The political control is not just of information, but the political control is also on grants, CDC grants to the states, but particularly NIH grants, which have been, badly harmed, including their international collaborative research. And so here are some of the things that have happened. One of the things that has made United States science and academic institutions great is a negotiated overhead that NIH and others pay to academic institutions to create sustainable laboratories, PhD programs, clinical trial infrastructure, and the like. Secretary Kennedy decided that he was going to unilaterally slash grant overheads for all academic institutions across the board. Right now, currently, that's in abeyance due to a court order, but it, I think, gives you a pretty good indication of what's happening. In the United States, there has recently been an enormous uprising against a new Office of Management and Budget proposed rule. This is something that the National Academy of Sciences, which I'm a member of, has been up in arms about, as is the American Public Health Association and every other scientific agency. Under this new OMB proposed rule, every single grant that's given out by the federal government in health science, but in every other area, will be formally under political control and oversight. And so rather than, for example, at NIH, the standard way of providing grants is based upon scientific merit, which is judged solely by other scientists through peer review. I know this because I was the last appointment of President Obama to the National Cancer Advisory Board, and I spent 6 years working on cancer protocols. And I can tell you that there was never a political control over any of them. But from now on, this is going to happen, and it will go through. There was recently a national comment period. There were about 30,000 comments sent to the OMB. About 97% of them were opposed to this rule. The other 3% were just form letters that were just signed, which shows an overwhelming public and scientific opposition to it. And I was recently asked by the media, will this mean it'll be stopped? Absolutely won't be. We expect this to go into effect sometime in September or October. One of the major areas of the Trump administration has been the parallel to the MAGA movement, which is the MAHA movement, the Make America Healthy Again movement that Robert F. Kennedy Jr. has overseen. And what this has done is to undermine vaccine confidence in the United States. I'm going to talk a little bit more about vaccines in a little while, but I wanted to just flag it now. Recently, the HHS and the Agriculture Department put out new dietary guidelines for Americans. These are enormously influential guidelines. These guidelines are intended to influence food policy under the SNAP program for hospitals and for many other areas of American public life, and they're usually influential with the public. These dietary guidelines are kind of reformed every 5 years. Under the Biden administration, there had been a rigorous scientific process and a report made about what these guidelines should be. When the Trump administration and Kennedy took over, they dumped that report and came up with their own guidelines. And to be fair, there's still a lot of advice in these guidelines that coincided with scientific evidence. But right at the top of these guidelines is beef tallow and big steaks, and which certainly is not what the previous scientific report had asked for. In addition, Kennedy is not just promoted beef and beef tallow, but he's promoted raw milk and other things. One of the big areas that MAHA was involved with was the kind of herbicide in Roundup. I don't know if any of you have been following this, but it's a very interesting debate. And there was just about a week ago, there was a Supreme Court decision on Roundup. I actually have an article coming out next week in JAMA on that Supreme Court decision. But it was really interesting to kind of look back and see a kind of case study about MAHA. When the Make America Healthy Again movement came and Kennedy came to become secretary, he published the first MAHA report. I could talk a lot about that report. I've written a lot of articles about it, but that report basically was really hostile to food additives, pesticides, and other things, which is very much part of the MAHA agenda, and I think, in many ways, rightfully so. And it said that there would be strict regulation and a ban on Roundup and other areas. Following that, President Trump told Kennedy that he had to meet with industry leaders. And then there was a second MAHA report that never mentioned Roundup at all. Subsequently, the president issued an executive order which basically called for a surge in the ingredients for Roundup as a national security threat. And Kennedy was forced, against all of the things he said his whole life, to support it. And there was a big breakup in the Maha community. Fast forward that to the Supreme Court, and the court was asked to decide whether to uphold or to strike down billions of dollars in liability costs to Monsanto, which was and Bayer, which acquired Monsanto's, and the court basically was faced with this prospect. The World Health Organization has said that Roundup is a likely carcinogen, but the FDA did not put that on the food label, on the pesticide label, nor did the Agriculture Department, which is actually, in fairness to U.S. agencies, very similar to what agencies have done, similar agencies in Europe and in other countries. And so Bayer was told that it can't change its labeling, which didn't disclose the cancer risk. And as a result, it went up to the Supreme Court, and the Supreme Court wiped out all of the liability against Bayer completely, and also future liability. Now, whether that was right or wrong, it suggested to me that while it's normally a good thing to have uniform national standards around science and health, it's all predicated on the idea that there's rigorous science at the federal level. And I can no longer say that that's true. And so now the Supreme Court has preempted any state regulation or tort liability relating to many potentially hazardous products, while at the same time, at the federal level, you've got, at least I have very, very little confidence in what they're going to do. Also recently in the United States, you might be aware that there's been a major outbreak of a parasitic foodborne disease linked to lettuce. This has been a real major concern in the United States, but it turns out that something like 75% to 80% of CDC staff that were in existence working on foodborne illnesses before the Trump era are no longer there. So we were unable to rapidly detect the source of it. Then when we did detect the source of it, it turned out that that source had given a lot of political contributions to the Trump administration. The corruption, whether in this administration, has just been, in my mind, jaw-dropping. I mentioned the Supreme Court. One of the things that has been particularly troubling in the United States is the Supreme Court's unitary executive theory. And under this, it's kind of a theory of democracy that's used to be just a fringe theory on the conservative right, which now been completely adopted by the Supreme Court, which basically states that the president is the executive and that he controls every executive branch of government. And even the Federal Trade Commission, which was erected by Congress as a fully independent agency, it came before the Supreme Court, and they said no, that the president has the right to fire FTC commissioners at will and without cause, even though Congress itself had said that the president has no such power to do that. Not in this term, but in last term, in a case called Braidwood, the Supreme Court was asked to examine the CDC and HHS's United States Preventative Services Task Force, which basically creates science-based rules that govern free preventive services under the Affordable Care Act. And while the Supreme Court upheld the U.S. Public Health Services Task Force recommendations, in the process it did something extraordinarily troubling, which basically said that the Secretary of Health had absolute and total control over the recommendations of this task force, as well as the Advisory Committee on Immunization Practices. And so now, with the blessing of the Supreme Court, there's complete and utter political control over the scientific agencies in the United States. All of these things taken together, I think, are deeply troubling. And they're, I think, worrying for the United States because, in my view, if you look back over the last, say, half a century, science has been the engine of the United States economy, technology, and innovation. And we are very rapidly, in my view, losing our competitive advantages relating to the scientific establishment in the United States. We're hemorrhaging scientists. Young scientists are leaving the field. Both the state public health and federal public health agencies, scientists are leaving or they're being fired. And the firing of scientific advisory committees, as you may know, the Advisory Committee on Immunization Practices was completely disbanded. Every immunization scientist was fired by Secretary Kennedy, and he appointed his own people. I have my own experience with this because I was a member of the Scientific Advisory Committee at NIH of the Fogarty International Center. And the Fogarty board had asked me to meet with Jay Bhattacharya, who is the head of NIH, to try to argue with him, or at least persuade him to invest in science and particularly invest in international collaborative research. So I had dinner with Dr. Bhattacharya, who I know, and we spoke, for hours. And a week later, he sent me a letter, and in the letter it just simply said, "You serve at the pleasure of Secretary Kennedy, therefore you're no longer wanted at the NIH." I got that letter, and thousands upon thousands of other scientists, advocates, have gotten similar letters with no explanation. I should say one other thing that's connected to this kind of really coercive atmosphere that we're experiencing in the United States. A few months ago, there was an image that had gone viral on social media. The image was a photograph of Tony Fauci, who was, many of you will know, is one of the top scientists in the United States from NIH, and me, and we were both smiling. This happened to be taken at an event that Tony and I were at. and where we were reminiscing about our days with AIDS and the AIDS movement. Had nothing to do with anything else other than that and our friendship. But the caption on this viral image was, Fauci and Gostin are laughing after they'd killed millions during the COVID-19 pandemic. The person that reposted that viral video was Jay Bhattacharya, the head of NIH. And that's what we're focusing, that's what we're dealing with here in the United States. I mentioned earlier that I was the co-chair of the Nature Commission on Quality Health Information for All, and I recently wrote an article for the journal Nature about why quality health information is a core and fundamental determinant of health. In many ways, accurate information is now the greatest human challenge for health and justice that we face. And it's a really hard problem because health information now is not just given by the government or by health ministries or anything like that. Health information is ubiquitous. It's all over social media. It's amplified through fake images generated by artificial intelligence, repetitive bots that put forward crazy ideas. And many of our citizens, and particularly our young people, face a cacophony of information from social media, influencers, and conspiracy theories. I have no idea why anybody would listen to an influencer about their health, but it's a lot of how our young people are making their health decisions. And right now, at least in the United States, there's really no safe harbor for information that's reliable. Because as I've talked about with the CDC and NIH websites, if you look, for example, at the White House website, there's a huge banner that says it's been proven COVID was started in the Wuhan Institute of Technology laboratory. There's almost no evidence that that's true. The United States intelligence agencies were asked to look into it. They didn't find it to be true. And I happen to be the lead author in an article in the New England Journal of Medicine about the origins of SARS-CoV-2. And we did a meticulous examination of where the most likely origins came from, and we came with a lot of evidence to the Wuhan wet market. Now, it's always possible that it could have been a laboratory leak, but there's no evidence, and yet there it is, blared out on the White House webpage that was the cause of COVID. I think it's no secret that vaccines are under threat. I don't know if you happen to see any of the US news, but today, measles cases in the United States hit a 35-year high. We're very likely to lose our measles elimination status by the end of this year. And by looking at what Secretary Kennedy says and the MAHA movement said, you would hardly know that the CDC, when it was a real CDC, said that vaccines were the greatest public health achievement of the 20th century, and in fact, they're the safest, most effective intervention among all public health and medical tools. Yet childhood and adult vaccination rates are plummeting. They're threatening, as I say, our disease elimination status for measles, mumps, rubella, and chickenpox. And even the old bogus idea of the links to autism for measles vaccination are reemerging with the full force of the United States government. And among our most exciting technologies, for example, messenger RNA technologies are being undermined by public suspicion. There are many states now that have banned mRNA technologies. And as you know, Robert F. Kennedy Jr. canceled all mRNA vaccination research grants. This is, to me, staggering. At the same time, the Supreme Court has had a very muscular view of the freedom of religion and is therefore on the verge of saying for the first time in Supreme Court history that states must provide broad religious exemptions to childhood vaccination requirements. This will be devastating for our vaccination rates because while there's no major religious doctrine that is against vaccines, quite the reverse, because they're so connected with childhood survival and life, most religious traditions support them very much. But this is being used, religion is being used as a subterfuge for just refusing vaccinations. I actually know this because during the COVID-19 pandemic, I was chairing the Public Health Advisory Committee at Georgetown University. We had a COVID vaccination requirement at the time, but we did allow religious exemptions, but we checked for them. And I found out that of the thousands and thousands of exemptions that were claimed, virtually none of them were sincere or genuine. In fact, most of them were based upon form letters from the same Texas church from students who had never set foot in Texas. This gives you an idea of what we're up against right now. Now, there are many reasons for this. There's the populism, there's a backlash against COVID-19. But I think a lot of this has to do with the public misunderstanding the scientific method. And to be fair, I think CDC, WHO, and others, and I've talked to them about this, didn't handle risk communication very well during COVID-19. And I can get into many of the reasons why that's true. They acted with a certain lack of humility, a certain amount of arrogance. I have to say, I probably fit into that because I did a lot of public media during COVID-19 and appeared more certain than I think the science at the time allowed for. What risk communication should be is to say, this is what we know, this is what we don't know, this is what we're trying to do to find out what we don't know. But to explain to the public that science is not on or off. Science is a methodologically iterative process. And so what science does, it puts out a hypothesis, it tests it, and then it continually probes that result with new studies, new understandings. And during COVID-19, as we do with all health emergencies, we're having to make decisions under conditions of scientific uncertainty. And we need to convey that scientific uncertainty, and we need to show and explain what the scientific method is. Science, though, is not perfect. We all understand that. But there's no substitute for constructing health policy other than scientific evidence, and yet that's unraveling in the United States. One last thing I want to say before I conclude, which is kind of the new oxymoron of the America First global health strategy. I don't know how you can have a global health strategy by favoring one country above all the others. But that's what our current strategy calls for. And what it entails is, instead of multilateralism and international cooperation, we've done the opposite. You all know that we withdrew from the World Health Organization, and I recently had an op-ed in the Washington Post, which basically had as its title, "You think we've withdrawn from the World Health Organization? Guess what? We haven't." The reason being that I was actually in Geneva during the World Health Assembly, and they took note of Donald Trump's announcement that he had withdrawn, and said, the World Health Organization said that they don't accept the United States withdrawal. And the reason is that there are two international treaties where nobody's allowed to withdraw because they're thought to be universal. One is the UN Charter. The other is the World Health Organization Constitution. Now, it's true that the United States, when it joined WHO in 1948, it did so under a joint congressional resolution signed by President Truman. And in that, it gave the United States, which as the only country in the world with the right to withdraw, on two conditions. One was a year's notice of the intent. Trump did that. The other is to pay all of your obligations, financial obligations. He hasn't done that. WHO said you can't leave, but you also can't vote. And actually, that's a good thing, because when America comes to its senses, I assume one day it will, it won't have to rejoin the World Health Organization. It will already be a member. Let me just end in this way. The United States, but also other liberal democracies, and I used to live in a liberal democracy, have really become much more rigidly individualistic, prizing, autonomy, me. This is true with individuals and groups. It's really, what does everybody, what does my government, what does the world owe to me? And we're seeing that with whole countries like the United States, with America First or MAGA, where national sovereignty, my country, what do people owe my country? People have been taking advantage of my country. It's all about me. And we've really stopped asking the question, not what can you do for me, but what can I do for my family? What do I owe to my neighbors? What do I owe to my community? What do I owe to my world to make it all a better place, a safer place, a place where we nurture our planet, and we have clean air, we have clean water. What happened to the idea of a world built on equity, justice, partnership, solidarity, based upon shared democratic values? It seems to me that equity, justice, and solidarity based upon those democratic values actually is a future that's worth fighting for. To put it all another way, we have to start rejecting selfishness, indecency, dishonesty, and we have to begin to embrace mutual obligations, compassion, and yes, love for one another. Thank you. Come back down.
Larry, thanks for that. Why don't you have a seat up here?
Should I just? You want to
No,
sit
no, you
here?
come and join us up here. Larry, thank you very much for that. That was just a superb outline of some of the issues that we read about and experience in different ways. So somebody as close to it as you to hear this is increasingly is heavily despondent in thinking about it. On the other hand, it helps us to understand the realism of the situation as at the moment. It's my pleasure tonight to facilitate some discussions here with Larry, but also to invite Professor Julie Lessig to the stage. Many of you will know Julie. She's not only a fantastic scientist, an outspoken and clear advocate, particularly in the field of immunisation and vaccination, and just an extraordinary communicator about science in many other ways as well. Those of you who don't know me, as I was introduced as the co-director of the Leeder Centre for Health Policy, Economics and Data, I feel like a bit of an imposter being dragged in here tonight in terms of presenting here. But this is obviously, as a public health physician, an area that's very important and close to me, so I'm very pleased to be invited. I'm going to take a chair's prerogative here, because it turns out that in the audience with us tonight, we also have Professor Brett Sutton. And Brett is the director of I think it's called Health and Biosecurity within our premier national research organisation, the CSIRO. But Brett also had I'm not quite sure how to describe it, as privilege or pain of being the Chief Health Officer in Victoria at the time of COVID, and was probably, of the Chief Health Officers in Australia during that period of time, the person who was most exposed to vitriolic and complicated responses to situations. So, Brett, I'd really like to invite you to join us on the stage as well, because I think you'd have some really interesting things to say in this space. What we're going to do is we're going to take the opportunities, those of us, so Julie, myself, and Brett, to just say a couple of words on the topic of public health science and trust in the Trump era. And we'll just have a few minutes of that, and then we're going to open it up to questions. If you don't come up with them, I've got some questions that I want to certainly ask of my other members of the panel, but I'm sure also there'll be some interesting questions from you. So I'm going to start by asking Julie if she'd like to make a few comments around the topic. Brett, I'm then going to move to you. I'm going to then make a few comments. Larry, at that point in time, if there's anything that you want to respond to in terms of what we've said, please feel free to at that point, and then I will open it up for some questions.
Hello everyone, just because I'm short, I like to be able to see you all. Thank you so much, Larry, for a wonderful address. It's certainly a bleak picture that you're experiencing in the US, and we've been following that in Australia intensely, as you know. But I'm going to focus on some solutions. Roger said I had 5 to 8 minutes to make a few comments, so I'll try and make it 5 minutes because we want to have some interaction. But first of all, I'd also like to acknowledge the Gadigal people, and also proudly representing Sydney Infectious Diseases Institute and the School of Public Health, and some of my colleagues from that school are here with us to this evening. So first of all, just to say, in terms of what's happening with trust in Australia, the picture is not as bleak for us. So 46% of people in Australia, according to the OECD in 2023, trust government. But that means that there's a whole bunch of people that also don't trust government. However, that rating is higher than most countries, where the average is 39%, so 46 versus 39%. But there has been an increase in trust in government since 2021, and that's also a positive and hopeful thing, which is nice to be able to convey when we're seeing the challenges that the US faces. And 64% of people in this particular survey said they trusted healthcare systems. But that means that 36% were not trusting healthcare. So again, that's a real concern, particularly when you think about vaccination, which is heavily influenced by people's trust in healthcare, in institutions, in government, and in health professionals. So vaccination, you might have heard that our vaccination rates in Australia for children are declining slightly. They're now for 2-year-olds at 88%, which is a real concern because we need 95% of those 2-year-olds in Australia to have good control of measles. And for adolescents, that's declined even more. And adults, they're just perpetually low. So only 27% of adults have had at least 3 of the recommended and free vaccines for them. And their reasons are complex. It's not just an issue of trust, it's also access to primary care, which has been challenged in the last few years. But in terms of trust, as I said, it's a big predictor of vaccination. And we're also becoming, we are partisan around our acceptance of vaccines in Australia. So the far right in Australia are a lot more likely to dislike vaccination than the far left when you're looking at relative comparisons. And those sorts of differentials are a real concern, because what we don't want happening is for there to be increasing partisanship around vaccination. That would be a disaster for the practice, because a whole bunch of people would then relate their identities with, if they're more towards the right end of politics, with being meant to be more sceptical of vaccination, because that's the group identity I should occupy. So what can be done? Well, first of all, focusing on what makes institutions trustworthy. And some great work has been done around this. Ortwin Wren and Deborah Levine said that trustworthiness comes from competence, and Larry talked about the threats to that in the US with all the degradation of science and funding for research. It comes from objectivity, a lack of bias, from fairness, and in particular addressing inequities, including in access to vaccines, in openness and empathy. And I'll never forget one of the most wonderful ways of expressing the importance of that in primary care from Victor Montori, who was also a US leading thinker, is if you want to be good at medicine, be careful and kind. And as a former nurse and a midwife, I'd echo that for our profession as well. So just a few really quick things, Andrew, I promise. What do we need to do in practical terms to strengthen trust in vaccination, which is my lane? It's to support primary care professionals, because they're a focal point for people's experience with expert systems and governments. And primary care professionals have a profound influence on people's experiences with vaccination, which will affect their trust for better or worse. Engage with communities. Now, kudos to Victoria during the pandemic. They resourced this very well, because they knew that they needed to have communities really step up in encouraging COVID vaccination. And strong political commitment that tries to avoid partisanship. I called my colleague Katie Atwell as political scientist. I said, Katie, quick question, how do you reduce partisanship around a topic? Which was a horrible thing to do to her as a political scientist, but we had a good chat. And we agreed that we should not magnify partisanship if it doesn't actually exist, because then we crystallise it and talk it up into something it's not. and increase the risk of people identifying with being a vaccine skeptic as being part of my ideological identity. Intervene in areas where partisanship is emerging, so politicians should be reaching right across the political divide to try and co-opt people on the far right into being supporters of vaccination, including by appealing to the values proposition of vaccines as something that we can choose to do that is good for our health and our families' health. And then a couple of more things, doing good crisis communication. Right now in Australia, if we had a vaccine safety scare, whether it was real or perceived, we have no communication plan from our federal government that is available, that is publicly known, and that is rehearsed. And that is a vulnerability that they've heard about from me a few times, and hopefully that will change. Deal well with grievances. So if people are unhappy about something in systems, in institutions, dealing well with their grievances can make a difference to rebuilding trust. That includes managing adverse events following immunisation well. It includes having compensation for true vaccine injury. And I'd say after any health emergency like COVID, debriefing communities well, which we didn't do well enough. And finally, reaffirming public health. Colleagues in the School of Public Health, we put together a statement. Becky Freeman's here, she was leading in this, to affirm the value of public health because we saw the threats to it from the US rhetoric and growing populism around public health. And that includes being transparent about our failings, reckoning with our blind spots, including legacies of colonialism, resharing our values proposition, and the things that public health does, right? Public health makes nothing happen. That's when it's successful, or it makes very little happen. Gun control, vaccination, road safety, pharmaceutical benefits, folate fortification, tobacco control, fluoridated water, Medicare, cancer screening, you name it. These are things that are done in the name of public health, and they bring benefits to things that most people can identify. And finally, calling on governments and all political parties to voice their unwavering commitment to public health as well. So there's a huge role for governments in building and keeping trust. Thank you.
Thanks, Andrew, and lovely to be here. I came here to learn stuff, but nice to provide some quick commentary. I think the main two reflections I have is, and it came through your talk, Larry, there's a deep intersection between trust in science, including public health, trust in national institutions, trust in media, and trust in government. And so some of the research solutions that we get to and some of the conceptual framing that we come to, I think has applications in those broader areas. And I don't think it's any surprise that the attack on the Capitol on January 6th came after a crisis in the US, and there was a parallel challenge to trust in government, trust in national institutions, trust in science, all at the same time. And so we can also sell this to government, I think, as important work that helps our foundational democracy and the resilience of that democracy, which I think they have an interest in. So we should talk about it in a broader frame than just public health if we've got an opportunity to do so. My other Venn diagram, and one that I'm quite fond of, is a conceptual framing for trust in science, which is now my new role in CSIRO as Senior Advisor: engagement, integrity, and the social contract. And engagement is all of those things that Julie was talking about in terms of communication, the iteration, and meeting people's needs with humanity and radical transparency and empathy. Integrity is a kind of non-negotiable. Integrity in the science that we do, the research, the publication, the science journalism, integrity of us as public servants, and the integrity of our institutions, and the way that we manage risk, because people have concerns about contentious science, including vaccines, obviously. And then on the social contract side, and this is where I think Australia's in a better position than the US in many regards, is because we don't have that deep libertarian leaning in the same way. We have universal healthcare. We have the Australian Electoral Commission that is government meeting people's needs and desires and priorities nationally. And I think that's an important part of the quid pro quo. If we're going to ask something of people, we also need to meet their needs, respond to their concerns, and have deep co-design in the way that we do our research, and make sure that we have a community-centred focus in everything that we do in that space.
Thanks for that, Rick. So I wanted to make 3 points, and I have to start with a confession, declaration, conflict of interest, whatever you like to call it. As a 16-year-old, I flew from the depths of North Queensland, having never left the country before, in the middle of the wet season in January, to the depths of Colorado in the US as an exchange student for a year. I flew there the year of the first major oil crisis. So there were queues of cars in San Francisco trying to get to the petrol stations. Queues of cars trying to get to the petrol station, and during that period of time, there was it was very influential, and it basically changed my direction in terms of where I ended up going. And part of that change was I went to Washington, and I stayed with a couple of neuroscientists who work at NIH, and they were extremely influential in me making a decision that I was actually interested in the whole area of medical research, etc. But it also, when I went to Washington, happened to be the day after President Nixon was impeached. And I'd been planning to go to the White House, and the White House was closed because Nixon had left that day, and nobody was allowed in. And it to this day, that feeling of depression on a city still comes back to me. I just remember how that city felt about the fact, and how that nation felt at the time about being let down by its president. I think it was an extraordinary feeling. But what it's always left with me is a sense of what you can get out of the USA, and I think, Larry, one of the things that really just rang with me is the concern about the impacts of Trump's policies in terms of science and what's happening in the science area. And you referred to some of that. I mean, just to bring that home to you in terms of the importance of where this is going, one of the other areas that I work in, which is as the past chair of the PBAC, and I obviously have an ongoing interest in pharmaceuticals. Last year, there were 23,000, there was of the new drug entities, things that may become useful drugs but haven't yet been tested. Of those, there were something like 5,000 to 6,000 registered from groups in the US. There were 23,000 registered from China. So it worries me a great deal that we're seeing this. I'm not worried that China is rising. I'm worried that we might end up with this situation where we have another dominant area in the world in terms of the provision of new pharmaceuticals, etc. And so it worries me to see that undermining of science, which is going on in so many ways under the Trump. The second point I wanted to make was around the issue of trust and where we are. Back in about 2000, under the Blair government in the UK, they commissioned a piece of work which was a foresighting. It was looking for what are some of the long-term trends that need to be considered in healthcare. And as a part of that, they looked at trends in terms of consumers, like in terms of patients and what they expected in that. And it is a piece of research which continues to implement me. They did a whole series of surveys, lots of focus groups, and a range of other work. And out of it, they came up with 7 characteristics that they thought were going to be important in what consumers and are going to ask of healthcare, things that were going to influence the way people thought about it. And I'm not going to try and remember them exactly, but the key ones were that people would be more questioning about their healthcare, that they would be more demanding of what happened in the healthcare space, that would be more critical of it, and that they would be less patient about waiting for things that happen. And all of those things have come to pass in terms of what's actually happening in the area. And I think that's part of what's happening when we think about trust and trust in public health, that it is part of a changing trend which has broader implications within the community. And then the last point I wanted to make is that one of the fundamentals of public health is the precautionary principle. Basically, what we teach in public health, what we practice in public health, is if we think there is a serious concern of health consequences, then we should act and we should limit exposure to whatever that happens to be in that regard. Now, that means that we make decisions sometimes with incomplete information. And in public health, we frequently have to make decisions without the quality of evidence that comes with randomized controlled trials. But it also leaves us more exposed to questioning the scientific basis of the decisions that we make in relation to this. So I think that is one of the reasons why trust, and Julie, I think, outlined this very nicely, is so important, because if we don't have that trust, then there will not be that acceptance of the fact that if we want to really reduce the health effects of exposures, and that includes, for example, climate change, we will be acting without necessarily all the information that everybody wants to answer every question that you have in that circumstance. I want to finish on just one other note, going back to the importance of Trump and what's happening in the US in this space. One of the key things that we have in public health is regulation. That's how we achieve population safety, population protection in that regard. And I was saying about the precautionary principle, that's an important element of that, of acting through regulation. But it also what it's meant, and particularly in the area of technologies, of medicines and things like that, is that there has been an increasing interdependency between agencies around the world. So we've seen, for instance, in the papers today, in the last 3 days, the TGA being criticised around its assessment of medical devices. But what underpins that, and what is lost in that sort of criticism, is the interdependency there is around the world, because there is so much medical technology being developed, so many new things people are being exposed to. It's not possible for any regulatory agency to be able to deal with that alone. And in a very important piece of that international regulatory environment in the health space is the FDA. And it really does concern me that the FDA has been undermined by the politics of what's happening in the US at the moment. So, Larry, is there anything that you'd like to comment on anything that we've said? Don't feel obliged to, but I just wanted to give you an opportunity to.
Yeah, just one thing. You know, I do a lot of traveling around the world, and I found one of the things I found is that I'm actually more patriotic than I ever thought I would be, because I'm so sad to see America that way, and that must mean that I love the country in some ways. And so I try to, a lot of my friends just want nothing to do with the United States, and I totally don't blame them. But one of the messages that I try to convey to them, and I'll just do it with you as well, yes, I've talked a lot about all the negatives of Trump and Kennedy and just the horrible things that are going on in the United States, and I stand by them all. But at the same time, America has got some incredible people. Scientists, humanists, humanitarians, human rights people, philosophers, people who care deeply and are really talented. And so that's my hope, you know. My hope for America is that there are so many people that are really good people and have such talent, energy, creativity, that's what I hope we'll come back to.
Thanks, Larry. Questions? Anybody have any questions that they would like to ask of Larry in particular, but of any of the panel, or points that you might like to make?
I've got a question of Larry. I'd love to ask you, Larry. You talk about the need to promulgate the scientific method, and maybe it's people's failure to understand in depth how foundational it is and how we apply it. But it's not something that's only emerged in the last 5 or 10 or 20 years. What are the other drivers that have taken us to where we are now? There's deeper economic inequality more than ever before. The corporate oligarchy has us. Social media has exponentially and fundamentally changed the world. Are these some of the other things that are at play in the shift of the last 5 or 10 years? And Rupert Murdoch might be the other one?
Yeah, I mean, all of those things. I mean, you're exactly right. There's been a real confluence of problems about where people get their information. And it's a lot of it, a lot of what goes on and kind of people's ideas about being so dispirited about the world, they're true. There is a lot of inequity, a lot of people think that the kind of academic and government and political elites look down on them, and they're not wrong. And I think there's a lot, there are important truths to this, and so I can understand the policy disagreements. I mean, I don't know anybody. I mean, Washington, D.C., and where I live in Maryland, nobody's voted for Trump. I don't even know anybody that did. But I do think that there are policies that we need to discuss, and they're fair. But there's just one thing I just cannot wrap my head around. It's what I ended up with. How is it that dishonesty, corruption, deception, just plain meanness, vindictiveness, how did that get to be okay in anybody's mind? I don't care what your political persuasions are. I don't care what your politics are. We all know that it's wrong. I mean, would any mother in the United States or anywhere else in the world want their children to be around Donald Trump, their daughters? Would they want, would they accept that kind of crass, childishness of insulting people and demeaning people and using your power over people? This is just fundamentally wrong. It's indecent. It's immoral. And that's the only thing. None of the kind of rational things that we might disagree about, to me, excuses that. And I don't know where that's come from. People are not like that. So if anybody's got an answer to that, I'd love to hear. You do.
Well, I think it's interesting to look at Trump through, and this won't be new to many of you, through the lens of malignant psychological states like narcissism, and when narcissism and possible degradation of his thinking functions collide. His niece talks about this. She's pretty careful in the way she does it because no one should be diagnosing from afar, but it's a very interesting lens if you want to understand Trump, to read up about narcissistic traits and malignant narcissism, and I have found that helpful in understanding where he's coming from.
Thanks, everyone. Fantastic evening. Julie, you mentioned political leadership to decrease partisanship. What's in it for a politician who wants to get re-elected to decrease partisanship if that's the method that they get elected?
Look, I'm not a political scientist, so I don't have easy answers here, but politicians are all the time working across political divides, often quietly, often in parliamentary committees, talking with each other. And so they have some expertise in this. So I'd be putting this dilemma to politicians. And in fact, if you think about it also, we have a lot of strengths with vaccinations. So, 94% of people or more parents support vaccination, and that's right across the political spectrum. And in fact, what I didn't say then where I was talking about partisanship is that although you do have relatively more people who are vaccine sceptical on the right side of politics, the vast majority of people are supportive of vaccination, including on the right side of politics. So there's a values proposition on that side of politics as well to support vaccination. And if those values can be captured and there can be a common language of values that can reaffirm the importance of vaccination and all that it does, protect people, bring solidarity, social conformity, because that is something that also drives vaccination, then there are ways in which a common language about vaccination can be found. So don't know if that answers your question, and I don't think it's an easy thing to solve, but we mustn't let it go the way of climate change, for example, which has become very partisan in terms of positioning and solutions.
There's always been a lot of wackos in parliaments in Australia as in anywhere else. Sorry, not a lot. There's always been a few. It's just in the past they haven't had the airplay, is my view. In terms of it, but now they can get a lot of airplay even if they just yell at their dog. Please, just over here. We'll come to you.
Hi, thanks for all the really interesting comments. I was interested in what Julie said about connecting identity politics to, attacks on science and stuff like that, because we're seeing a rise in identity politics and populism across the world. It's not just in the US. So is the US just the vanguard of this? Does it get worse before it gets better? Like, are other countries going to go down the same route? Are we seeing other populist leaders attacking scientific institutions the way that Trump has?
The other morning I decided to delve into the literature on partisanship around vaccines, but obviously it's a broader thing. And it's it's been a problem in the US since 1988 in relation to childhood vaccines. So it started to emerge then, according to one study. But in other countries, it's definitely become more of a thing around vaccination. And I'm not sure about science more broadly, very likely. And it's quite diverse, but generally speaking, strong democracies have less political partisanship around vaccination than weak democracies. And there's some great papers after this sort of curiosity journey I took the other day around this that have been published around this by people like Antonini from the London School of Economics. So it's worth having a look at, and I'm happy to share that with you later.
Yes. Question with Professor Wilson, and I noticed is that New South Wales Clinic Excellent Commission from that, and I want you comment on that, So how about the health, the excellent of that, And I feel like institution, like a hospital in the front line, and implement all the guideline and the regulation. And now with my witness, it's broken. And in that is that hospital integrity, especially. And then when I see that in that, for example, Prince of Wales Hospital, and the hospital deaths, they are no reported bypass, the coroner inquest and the bypass, and then HCC all bypass by compromised case managers. And that's all happened. And so many deaths didn't report, and all that and people in self-report, and then personal attack, and abuse, and then most of the people, what I can see, one of the problem is that the body is lay people didn't understand the science, didn't understand my medicine, and any incident happened, it's a system you can see that people can brand them, family can brand because they don't understand medicine, and the incident happened, the doctor, and they have clinical notes, and they can change it. Hospital want to cover up, want to bypass, and then the Australia, like a coroner, in that early the country, they are the coroner, they didn't have the science background, all rely on the opinion. And that means all in that rely on the, they call the hospital or others say expert opinion, so-called. And that's the whole system, and I'm thinking the broken it. And that's I want to say, I witnessed it, I experienced, and that I just said, this time I want to determine that I want to stand up with my own case. And then that's why I want to say it. If, for example, in the hospital, picket line use, infection costs quite the suspect in infections, absolutely broken. If you raise the issue, personal attack. And that's my personal experience. I want you to make a comment on that.
Thank you.
Monitor and regulation.
Correctly, this is an experience that you've had in relation to the health system, and I'm sorry that has been that you've had such a bad experience in that regard of people not taking you seriously, if I've understood you properly. We try and build systems around to ensure patient safety and to try and deal with risk in this regard. But we have to admit that it doesn't always happen, and sometimes, bad things do happen to people. So I'm sorry if that's been your experience of the system.
Yeah.
We had another question back there.
But just finish.
No, sorry, you've had a question.
Oh, look, I can yell.
No, wait.
I was a teacher. I'm experienced in speaking very loudly. I have a couple of, first of all, Professor Gostin, I just think it must be so miserable and sad for you to be experiencing what you are at the moment, and I'm sure you have the sympathy of all of us, just thinking what a shit show you're all going through and how it's a disaster. But be consoled, because the pendulum does tend to swing back the other way, so their bright times are ahead. But my question really to all the panel is, what do you think the role of China is going to be in this? Is it seeing there's a big gap and rushing in, and if they are, well, is that such a problem anyway?
Yeah, I just spent about 3 weeks in China, and I've been there many, many, many times. I mean, I don't even know where to begin. I mean, China, even more so than it's ever been in my experience, has become a real security state. It's the, you know, the surveillance, the repression of its population, I think is really, it's not something I think that the world should be aspiring to. On the other hand, they're really beating the pants off of the rest of the world in the United States in a lot of different areas. Clean energy being one, electronic vehicles, batteries, and other clean energy products. I think they're well ahead of the rest of the world. And to the extent that that pushes the rest of the world toward a more clean energy stance and environment, that will be a good thing. I was also very aware, as what you were saying about clinical trials and their really rapid advancements. The United States was always in the top of the scientific literature and clinical trials and others. If you look now, at least on paper, they're not. China is. I'm kind of a little skeptical about that. I don't know about the quality. I know that there's a lot of publications going on. But I guess my bottom line would be this: liberal democracies, the free world, or whatever we want to call it. I hope they win. I hope that our science, our literature, our innovation, our pharmaceutical companies, our medical devices, I hope they prevail in the end. I think it will be a better world if we do.
Yeah, I think one of the elements to me that distinguish the two countries or distinguish China from other places and which worries me about what's happening in the US at the moment is that there was within the scientific community, at least, and in the research community, a need, an openness in publishing what these things happening. And you talked about NNR now being NNR.
MMWR.
Thank you. It was, being censored, but it's not. That's only one of the documents which elements in which the current government is.
My good news, bad news on China would be it's in a very sweet spot for science. It's compressed 170 years of the Industrial Revolution into the last 30 years. And so it was the progress of the Industrial Revolution that made people feel so warm towards science because it was such a practical, manifest benefit to them and the way that they live their lives. And so China's experiencing that. On the downside, AI and the shared reality that we all have by virtue of the information feeds that we get will challenge China like the rest of the world. And China is deeply dependent on that narrative about what government says is true. And that's going to be chipping away at the edges very substantially, I think.
We had some more questions at the back there.
Do you think we'll see kids in calipers and iron lungs before we get vaccination rates up?
No, but because it's the nature of polio and where it sits with elimination. But we are already seeing measles cases. Measles is extremely infectious And Peter McIntyre, who was my boss at the National Centre for Immunisation Research, used to call it a heat-seeking missile. So whenever somebody's not vaccinated, that's where measles will turn up. And we have seen an outbreak of diphtheria across northern Australia in remote Aboriginal communities, but that is related, if not more, to living conditions and overcrowding and poor housing, as much as a lack of boosters in teenagers for DTP vaccine. So, but your question there, I think, points to that cycle of appreciation of vaccines when we see the diseases, and then we, as a society and particularly political leaders, I guess, become complacent. They don't recognise their values because public health is doing its job and making nothing happen. And then the diseases come back and they're vaccines are appreciated again. So you have this cycle that's been well described and seen, for example, in the UK with the MMR autism scare that started in 1998 with Andrew Wakefield, a doctor, publishing in The Lancet. And, they had a decline in vaccination coverage, they had measles outbreaks, and vaccination rates slowly improved. So it is a cyclical problem. And unfortunately, the MMR autism ideas have come back. And actually, research done by my colleagues last year, where they surveyed 2,000 parents in the National Vaccination Insights Project, they asked the respondents, have you heard anything in the last year that's worried you about vaccination? And 17% said yes. And when we asked them in free text responses what that was, a lot of it was about what Trump was saying about vaccines and autism and too many and so forth. And providers in Australia of vaccination are really seeing this rhetoric already leaking through to Australia. So what's happening in the US is causing damage here already and will continue to do so. So we are in a concerning time.
Yeah, it's probably reinforcing things which were happening here to some extent as well. There was already some, concerns about that in elements of the community, and this is it's sort of amplified it, hasn't it?
Yeah, concerns about vaccines are perennial, and there are worries about children. Parents want to protect their kids, and sometimes they worry about the number of vaccines children are given, what's in them, are they really necessary, might they cause harm in my child who's unique? And so they're real concerns, and they've always been there ever since vaccines were developed. But when you have someone in the US like RFK Jr. supercharging the sanctimonious rhetoric of science and coating it around his lies about vaccines, then you've got a real problem and a real worry in terms of the impact of that misinformation.
Question at the back there. Oh, over here we go.
Thank you very much, sir. Excellent lecture. Thank you. My name's Neil. I'm a health scientist, astrophysics, Charles Darwin University. Looking at the big picture, I'm a centrist. Thanks for the jokes on Trump. I think he should probably be syphilis testing in the public domain as well. But yeah, I'm a centrist. I just look at the big picture. I think they call upstream thinking from a Catholic kind of health scientist perspective, sort of a pro-life sustainability. There doesn't seem to be a formula. I've sort of worked out something, but nothing that I've seen published. But there's also issues with cultural Marxism, and there's some unhealthy lifestyle choices which sort of juxtapose to the free preventative medicine of the sort of the Christian right that sort of might be anti-vax, I don't know exactly, but the statistics. But yeah, just thought if there was a take on that, some kind of a truthful kind of approach to it all on sustainability, the academia, and what is the impact of cultural Marxism, and can we restore trust, and is there some kind of way of bringing in a sustainability formula without this culture of death? you know, it's hard. I know it's hard, but I just thought if you might have had a suggestion or a website that you could look at that does have, like Planet Ark or Catholic Earth Care or someone that's worked this out. Is there anything out there that we can look at to as an authority that gives us hope, you know? And astrophysics too, you know, you can't really lie in astrophysics. It's a lot of lies in the Marxism, but just thought if you could clear that up for me and give me a reference, it'd be lovely. Thank you very much.
No, I don't think I have anything.
Challenging questions.
We'll have to have a conflab and see if we can come up something with an answer for you on that one off screen.
What was the question?
I mean, could you repeat your question? You've got a lot of ideas there. Could you repeat the question in one sentence? Is that possible?
Formula between the two juxtaposing ideologies of cultural Marxism, which is cynicism, China and all the militant atheist suppression. Then you got the far right, you know, on there as well, the Christian right, the American. I suppose you can strongly call it like the dark matter of this financial banking dark matter, and then there's this cultural Marxism dark energy, and they kind of work together, and they should work together, but there seems to be an imbalance, and there doesn't seem to be, with exponential population growth and all the financial system, there seems to be a Marxism agenda going on in law, and it seems to corrupt through science. That's what I'm getting at.
Thanks for the comment. We've got somebody else has the microphone here. Who's got?
Hi, my name's Emily. I'm currently working at Impact Global Health, and I have a background in contraceptive and safe abortion research. And there's so much underfunding in women's health and contraception and safe abortion, as we know. And I was wondering, Julia, as you were talking about trust, how do we rebuild trust in the women's health sphere, especially because the current contraceptive products on the market are not really meeting the demands and the needs of women currently, and with funding decreasing, how are we going to rebuild that trust if it was ever there in the first place?
I think you said my name. I've been out of midwifery for a long time and women's health directly. But what you're talking about speaks to people's experience with accessing services that are important for them and respect for autonomy. And these questions of how you rebuild trust are really, really difficult, particularly when you have a lot of partisanship around the subjects that are increasing. So I suppose it goes back to what I was talking about earlier. I don't know how you address that with access to abortion, but with women's health at a general level, it's recognising that when women seek healthcare, they're more likely, their pain is more likely to be relegated to the psychological and not taken seriously, and that can be very bad for their health, undiagnosed heart attacks and so forth. So recognising that as a problem, naming it, and then addressing it systematically in healthcare so that the institutions are taking responsibility for the poor treatment and grievances that are legitimate.
Yeah, and I think we can learn a little bit here from, the idea of truth-telling, of, you've got to actually acknowledge there's a problem before you can do anything. People have to acknowledge that things may have moved on, things may have changed as part of that trying to regain trust. So I think we're at a sort of almost the start of a journey in some way of that sort of, well, let's hear what the issues are, and we've heard it, with the pain stories obviously being one, or the failure to recognise and appreciate women's pain for that. The issues around childbirthing and some of the issues there, again, another set of things where we need to actually hear the stories and listen to the stories, and then we can respond to them as a society. One more, and then we'll have to call it off. So at the back there, it's been trying since the beginning. Just wait till we get to the microphone, otherwise I'm having a great deal of difficulty.
Hi, I'll make it quick. Thank you all. I've had such a wonderful time here, and as an American, I really enjoyed you, Professor, elaborating on the current state of our union. My question is, in the United States, I see a big connection between right-wing extremism and Christian nationalism. So the first part of my question, is that also occurring geopolitically and specifically in Australia as well? And if it is, or if it's not, because it definitely is in the United States, how then, if people are electing right-wing populist and they're attaching their religious ideology to it, especially in terms of vaccines, then how can we help to either educate or kind of eradicate that belief that there's some type of a religious connotation to their political voting?
This is such an interesting question. As a person of faith, actually, of a long time, and I see this happening. I saw it happening in the 80s when if you went to a Pentecostal, sort of what you might see now in the US as a Christian nationalist, sort of quite radical church, there were these ideas about credit cards holding the number of the beast and being the fulfillment of the book of Revelation. And they were very compelling and interesting and conspiracy beliefs that have then morphed into vaccines putting chips in our bodies, which will then be part of the one world monetary system and symbolise the number of the beast. And so these ideas are out there and we've got to be able to understand them. And if you look at mRNA technology, if you look at microarray patches, for example, and Kristen Davies, she's done a lot of work in this area. Some of the developers of microarray patches that would deliver vaccines not through needles, but a tiny patch that scratches the surface of the skin and puts the antigen through there. They're talking about putting them on the right hand or as a wristband. That would be a really bad idea if you understand this stuff, because part of this was the number of the beast would be put into your, on your right arm or your forehead. So you got to go into these beliefs and understand them, and then look at how your new technologies are matching up with those potentially, and be very cautious about how you talk about them, how you present them, rather than just dismissing it as crazy stuff.
So, ladies and gentlemen, unfortunately I have to draw proceedings to a halt. Thank you for coming tonight. We really appreciate your questions and for you listening to us. Of course, Professor Larry Gostin, thank you very much for your address. It was, as I said before, so interesting to hear this from somebody who has lived it for so long and lived through so many presidents and now this one, and I'm sure you'll live through this one and try another one afterwards as well, or at least I hope you do. Thank you, Julie and Brett, for joining me here on the panel and contributing, particularly Brett, given that we didn't really give you very much notice to do so. I'd like to thank the sponsors of our night here, the Sydney Infectious Diseases Institute, the United States Studies Centre, the Health and Law part of the School of Law here. So thank you very much for organising it, and please join us in some refreshments.